Gerard was wrist-deep in Ambassador Krenth's abdomen when the Celestial Dreams reactor core decided to quit. The luxury liner shuddered, emergency lighting bathed the medical bay in red, while 50,000 passengers screamed across subspace frequencies that made his teeth ache. Through the observation port, debris tumbled past like metallic snow. Doc. Corpsman Martinez appeared at his elbow, combat harness already strapped on. "We've got incoming distress coordination." Gerard didn't look up from the Andorian's ruptured liver. Blood coated his hands. Not the first time, wouldn't be the last. How many? 8,000 critical. 50 total. The kind of numbers that made normal doctors request reinforcements. Gerard just nodded and made another precise cut. Time to structural failure? 40 minutes. Then we better move fast. The comm crackled with an incoming transmission. A scaled face appeared on screen. Dr. Kethvar of the Saurian Medical Collective. His throat sacs inflated with what Gerard recognized as bureaucratic anxiety. "Dr. Gerard," Kethvar began with formal cadence, "I must express concern regarding human medical procedures. The Saurian protocols require molecular-level compatibility screening before any invasive doc." Gerard's voice carried the patience of someone explaining gravity to a child. "Clear the bay. We've got 8 minutes before this bucket becomes scrap metal." Kethvar's scales bristled. These were the species that had performed surgery with plasma rifles during the Proxima siege. Who had learned anatomy by rebuilding soldiers faster than war could break them. Perhaps a more civilized approach would be appropriate, Kethvar suggested. "Our molecular healing matrices require no crude physical intervention. Your matrices don't work when someone's organs are decorating the bulkheads." Gerard sealed another vessel with mechanical precision. "Stay clear. We'll handle this." The transmission ended. Around Kethvar, his medical staff exchanged worried glances. In 30 years of practice, he had never encountered physicians who spoke of healing like tactical operations. "Veltha?" Kethvar ordered his assistant, her silver skin reflecting emergency lighting. "Initiate containment protocols. Whatever these humans do, we cannot permit experimentation on civilized patients." But as he watched the human medical ship approach, armored, weaponized, built for war zones rather than healing, Kethvar felt something cold settle in his gut. In 8 minutes, 50,000 lives would be placed in the hands of barbarians. The docking bay erupted as Gerard's trauma team deployed like special forces hitting a combat zone. No hesitation, no consultation, just surgical precision applied to chaos. Gerard catalogued casualties with the automatic assessment of battlefield triage. Gravity had failed in sections, creating 3-dimensional mazes of floating bodies and twisted metal. Blood formed crimson spheres that drifted like deadly stars. A Saurian child floated past, chest still, eyes closed. Gerard snagged the small form and pressed 2 fingers to the throat. Pulse present but fading. Combat stim injector hissed against scaled skin. 3 seconds. Tiny eyes fluttered open. "Martinez, Priority Bay." "Sir." The corpsman took the child with practiced care. Red tag. Yellow. "Kid's stable now." Veltha watched from the doorway, her silver skin flickering alarm patterns. The human had just administered unknown chemicals without diagnostic evaluation, genetic compatibility screening, or molecular analysis. "You could have killed that patient," she said. Gerard was already moving to the next casualty, an elderly Zenthari with her abdomen opened like a flower. "Could have, didn't." "Martinez, Trauma Bay 2, move." His field kit opened with weapon-like efficiency. Instruments that made aliens step back in horror. Vibrating scalpels, arterial clamps, emergency vascular grafts, designed for rapid deployment under fire. Kethvar appeared beside Veltha. "What is he doing?" "Surgery," Veltha whispered, watching Gerard slice into living tissue with calm brutality. He's rebuilding her." Blood floated around Gerard's head as he worked, but his hands never hesitated. Each movement was economical, purposeful, designed for maximum healing with minimum time. This was medicine learned in conditions where hesitation meant death. "Your medical protocols?" Kethvar called out. "Strictly forbid invasive procedures without proper environmental controls." "Ma'am." Gerard's voice remained steady as he reconnected severed arteries. This lady's got 6 minutes before she bleeds out. You can quote protocol or help save her life." The ship shuddered. Another explosion tore through lower decks. "All personnel," Captain Rodriguez announced, over intercom. "Structural integrity failing in sections 7 through 12. 18 minutes to complete hull failure." Gerard checked his patient's vitals without looking away from his work. "Martinez, Chen, Williams, deploy to trauma bays 1 through 3. Standard mass casualty protocols." He looked up at Kethvar with blood-stained hands. "Doc, I need your people evacuating ambulatory patients. My team handles the criticals. I will not permit you to butcher. Those people are going to die if someone doesn't help them." Gerard's voice carried military certainty. "Right now, we're all they've got." Around the medical bay, humans worked with efficient brutality. They moved like soldiers who had rehearsed their steps in hell, each action flowing into the next with deadly precision. Despite himself, Kethvar found himself watching in fascination as these barbarians began saving lives faster than his advanced training could even process the casualties. Gravity failed as the power core cascaded toward complete shutdown. Gerard anchored himself to the surgical table with magnetic clamps and continued operating as if physics were merely a suggestion. Around him, blood and instruments formed floating constellations, while he rebuilt Ambassador Krenth's crushed organs piece by piece. Standard procedure: keep blood moving, keep brain fed. Everything else was just plumbing. Veltha drifted closer, watching Gerard create order from chaos. He had rigged a containment field around his surgical site. Crude but effective, every movement was economical, designed for maximum healing with minimum wasted motion. "Monitor vitals," Gerard said without looking up from delicate arterial reconstruction. "Green line is heart rate, blue is blood pressure, red is oxygen saturation. I don't understand your equipment." "Lines drop fast," yell. "They flatline," yell louder. Another explosion, close enough to crack bulkheads. Hull breaches appeared in 3 more sections as the ship accelerated its transformation from luxury liner to debris field. "Immediate evacuation required," Kethvar's voice crackled over intercom. "Reactor core destabilizing. 4 more minutes," Gerard replied, continuing microscopic tissue reconstruction. "We don't have 4 minutes." Gerard's hands never stopped moving. "Then go. I'm not leaving this guy." Veltha stared at the human in bewilderment. He was choosing death rather than abandoning a patient. Not because of protocol or duty, but because someone needed him. But watching Gerard work, she began understanding something that changed her perspective entirely. The scars covering his hands weren't from inflicting violence, they were from surgical accidents, burns from emergency procedures under impossible conditions, cuts from operations where saving patients mattered more than protecting himself. "I'm staying," Veltha announced. Gerard looked up, surprised. "Kid, you don't have to. Show me what to do." Together, they worked to save the ambassador while the ship tore apart around them. Gerard guided her through human surgical techniques that seemed brutal but produced results her people's advanced medicine couldn't match under these conditions. "Why do humans learn medicine this way?" Veltha asked, as they sealed damaged vessels. Gerard was quiet, focused on closing the surgical site. "We've had practice putting people back together after war tried to take them apart. You learn to save lives fast, or you don't save them at all." Ambassador Krenth's vitals stabilized just as Rodriguez announced. "All hands, abandon ship. Reactor breach in 6 minutes." Around them, alien medical staff rushed toward escape pods. Gerard's team remained at their posts, continuing operations as if evacuation orders were meant for other people. Evacuation klaxons screamed through the medical bay as alien staff fled toward escape pods. Gerard's team continued operating with mechanical focus, soldiers under fire. "Doctor, we have to go." Kethvar grabbed Gerard's shoulder. Gerard shrugged him off without looking up from the Andorian child whose organs he was rebuilding layer by layer. "Not done. Reactor breach in 5 minutes. Everyone dies if we don't evacuate immediately. Kid's got 15 minutes left if I stop now." Sweat dripped from Gerard's forehead as he worked. "I'm not leaving." Kethvar stared at the human in bewilderment. You would die to save one patient? Gerard's response hit like a physical blow. Wouldn't you? Around the bay, Gerard's team had made the same impossible choice. Martinez continued operating while debris rained down. Chen worked frantically to stabilize Vulcan passengers, hands moving with mechanical precision of someone who had made this choice too many times. None had even paused at the evacuation order. Watching Gerard work, really watching, not just the surface brutality but the skill beneath, HFY began understanding something that fundamentally changed his view of humanity. Gerard's hands moved with precision from years of practice under impossible conditions. His fingers guided instruments with expertise that surpassed anything HFY had witnessed in 3 decades. Every movement preserved life at any cost. "Sir," Veltha's voice came from across the bay where she assisted Chen. "I understand now." "Understand what?" "Why humans are effective at this. They learned medicine in hell. We learned in paradise. When hell comes to paradise, we run, they stay and fight." Another explosion cracked bulkheads and sent equipment careening through zero gravity. Emergency power failed in 2 more sections. 3 minutes to reactor breach. Gerard looked up from his patient. Done. Kid stable. He moved immediately to the next critical case, without celebration, without pause. "You're all going to die," HFY said quietly. "Maybe," Gerard agreed with matter-of-fact acceptance. "But not them, not if we can help it." In that moment, HFY realized he had completely misunderstood what he was witnessing. Human brutality wasn't cruelty. It was unwavering commitment to preserving life that transcended personal safety or rational thought. These weren't barbarians. They were guardians who had learned to fight death itself. "What do you need me to do?" HFY asked. Gerard looked up, genuine surprise flickering across weathered features. "You sure?" HFY moved to assist with the next patient, clawed hands surprisingly steady. "My people may have forgotten what it means to fight for life. You've reminded me." Around them, human and alien medical staff worked together as the ship died, choosing patience over self-preservation. 6 months later, HFY barely flinched as plasma bolts scorched bulkheads around him while he performed surgery aboard the medical convoy Serenity. Pirates had attacked the humanitarian mission, but the Saurian doctor continued operating with hands that no longer trembled under fire. He had learned from the human. Sometimes healing required a warrior's heart. "Steady pressure," HFY instructed Thompson, a young human medic whose hands bore familiar surgical scars. Like Gerard showed us, the Serenity's medical bay represented something new. Hybrid human-alien technology neither species could have created alone. Molecular healers worked alongside combat surgical kits. Advanced diagnostics shared space with emergency trauma supplies designed for battlefield conditions. Dr. HFY. Veltha's voice came over intercom, carrying calm authority learned from human combat medics. Word from the Mercy. Gerard's team treated 60,000 casualties this month. HFY smiled as he completed delicate vascular repair, a procedure combining human directness with Saurian precision. Techniques that had once horrified him were now essential training for serious medical professionals galaxy-wide. The transformation had begun during those final moments aboard the Celestial Dream when human engineering teams arrived just in time to stabilize the reactor. But not before the galactic medical community witnessed something unprecedented. Doctors willing to die for patients, regardless of species or probability of success. 47,000 survivors, because barbarians understood something they had forgotten. "Dr. HFY," Thompson said as they worked on a Vulcan patient injured in the pirate attack. "Why do humans approach medicine so intensely?" HFY considered while monitoring vitals with instruments bearing elegant simplicity of human design. Around them, battle continued, but the medical bay remained focused, calm. "Because they understand something we had forgotten. Every life has absolute value, regardless of preservation cost. They learned medicine where failure meant watching people die, so they developed techniques that refused to accept failure. Through the viewport, human and alien ships worked together, evacuating civilians. Cooperation that had seemed impossible months ago was now routine galaxy-wide. 3-star systems away, aboard the Mercy, Gerard reviewed casualty reports from the latest crisis response. His scarred hands moved across displays with surgical precision, checking patient status across integrated medical teams galaxy-wide. "Doc," Martinez called from communications. "Message from Saurian Medical Academy. They want human combat surgical techniques mandatory for all emergency personnel." Gerard nodded without surprise. The transformation had been inevitable once other species witnessed what combat medicine accomplished under impossible conditions. Fear replaced by respect, then eagerness to learn. "Word on Veltha?" Heading New Zenthari Emergency Medical Division. Teaching zero-gravity surgical techniques to their entire fleet medical corps. Gerard allowed himself a small smile. The young alien who had been horrified by human practices was now one of their most effective advocates. His communicator chimed. "Industrial accident on Titan Station. 400 casualties. Toxic atmosphere. Limited evacuation window." The kind of nightmare scenario human medicine had been forged to handle. "Martinez, prep the team. We've got work." As the Mercy changed course toward emergency, Gerard reflected on how much had changed. Humans were no longer seen as violent primitives who happened to practice medicine. They were recognized as healers who had transformed their species' violent history into the galaxy's most effective life-saving techniques. The human medical ship accelerated toward crisis, carrying crew from 8 species united by simple understanding. When lives hung in balance, nothing else mattered. Not personal safety, not conventional wisdom, not comfortable assumptions that had once defined galactic medicine. Just the warrior's commitment to fight death itself, regardless of cost. In medical bays across the galaxy, alien doctors worked with scarred hands and steady hearts, having learned the most important lesson humanity had to teach. Broken things could always be fixed, if you were willing to pay the price in blood, sweat, and absolute refusal to surrender. Even when death seemed certain, there was always one more thing to try. Always one more life to save. Always one more reason to fight.